Hi, everyone, and welcome to a new episode of the Heal Cycle podcast. I'm your host, Ananya Grover, and today I have a very special guest, Dr. Ruchi S Mutneja, who is a consultant dermatologist. So today's episode is going to be all about skin health and how that relates to our hormones, our mental health, and we'll have a lot of advice, especially for the Gen Z among us. So, Dr. Ruchi has over 15 years of experience in clinical and aesthetic dermatology. She has done research and is committed to helping people feel confident in their skin. She currently practices at SparshAesthetics in Ludhiana. Thank you for joining us, Dr. Ruchi.
Thank you so much for the warm welcome.
All right, so let's start with a fun question for our audience. If your skin had a personality, how would you describe it on a good day versus a bad day?
Okay, on a good day, it'll be like a happy one because what I feel, your skin is the mirror to your system. So if you're happy, your skin has to show that happiness. And on a bad day, I would say maybe a kind of your skin will start showing signs of your anxiety, depression, everything. So most of the time you must have noticed somebody whom you don't even know, you will be sitting and commenting on somebody, ye banda bada happy lagta hai, I don't like this person because uske shakal pe gussa rehta hai. So somehow this has a scientific background as well, because when your system develops, your skin develops from something called ectoderm, and from there itself your brain also develops. So there's a direct correlation. Whatever goes in your head shows on your skin. So if you want to have a happy and glowing skin, you need to be happy from inside.
That makes a lot of sense. And thank you for sharing that. Actually, that was going to be my next question about this very connection. Like, how is our skin, our hormones, our mental health, how is it all connected? And what patterns do you see most commonly in the people that come to you for help?
See, as we at the beginning only we said, we'll be concentrating more on Gen Z because it's like that's the time when your body is facing a lot of hormonal change. So
Mhm.
your skin will change as per your system. Like, if your periods are about to come, you will face that your skin is going little dull, you have fluid retention, you don't look as good as as you always do. So somehow, even if you are on treatment, like somebody's here treatment for acne, everything is fine, and one fine day they're like, I have an exam coming up and I see new crops of acne, just because you are stressed. So
Mhm.
that stress hormone is responsible for the new crop. So those days, usually we don't have to alter the medication much. We like just continue the same thing and try to be happy and stress free. The same medication on the same dosage start giving you better results if you're happy from inside.
Mhm. That makes a lot of sense. And I think we have, like, even I've gone through that with exams, or later on in college, we have interviews for internships or jobs. And in those high stress periods, or once you start working, then there are other stressors. So in those high stress periods, I think our cortisol levels, right, will also result in breakouts.
Yes.
And so is this the reason why hormonal acne happens, or adult acne? Because this is something that even there is a lot of talk about this on social media. And sometimes people just panic or try to use a lot of different products. So what is your approach to this on, like, the product overload that is currently dominating?
What I personally feel and personally follow as well, you need to have a skincare routine that is simple and that you can continue it for a long time. It's not like initially जब बड़ी excitement होती है ना, we'll be using layer by layer products, and another 5 6 7 days when you don't get result, because when you're using so many products your expectations are high. You feel within 5 6 days some wonder is going to happen. So that's not the case. You need to have a simple skincare routine, maybe a moisturizer or night cream and a sunscreen. So that's good enough. You don't have to have some half an hour, 40 minutes every day for your skin. And I feel people like us, yeah, people like, who are working and who have so many things in head. If I start giving them a skincare routine which has some 10 or 20 steps, so it is like not possible even when it comes to me. If somebody asks me to spend some half an hour every day before I enter my clinic, so I would rather not do skincare than spend so much time. So I think this is the case with most of the people nowadays.
That's true. So, would you say you agree with less is more as the approach? And what is the basic skincare routine? I know you mentioned a couple of steps, but could you outline that for us?
Yes, definitely less is more. You just have to have a good moisturizer depending upon your skin type, and a good sunscreen. These two things are non-negotiable. You definitely have to use it if you really want to get into something called skincare, or if you really want to get into something called anti-aging. So if somebody asks me what is the best anti-aging cream, I would be saying moisturizer and sunscreen.
Hmm.
So this is how it works. And when it comes to PM routine in the night, you just have to have a religious routine that you will not sleep without washing your face. First thing. The moment you wash your face, just moisturize, hydrate, and that's it. In the beginning of your skincare, that's the only thing you need. The actives, like if you have acne, if you have pigmentation, or if you are looking for something like to detan your skin or anything of that sort, so that would be a concern that will require few actives like AHA, BHA, or maybe if you have an acne, maybe I would be thinking of prescribing some azelaic acid serum or maybe benzoyl peroxide. So actives will always be required just in case if you have a skin issue. Otherwise, like if you have an anti-aging issue coming up, I would be prescribing maybe something called retinol or something, or maybe two, three issues, and I have to combine few products. So that's the time we advise actives. But when we talk about teenage skincare, I would always tell them stay away from the products. You just have to wash your face and moisturize. That's good enough for another few years. It's
Hmm.
like your childhood should remain childhood rather than, I feel bad when, teenagers come to me and they talk about, I have cross feet, auntie. I was like, really? You notice that much? And then they'll come and they'll say, ki, I have a lot of pigmentation. I was like, if you've already made a diagnosis, then, I don't think so. I have anything to say. So, for a teenager or somebody who's just facing hormonal change and seeing the change in the skin, so I always say just embrace what is happening. Like, I still remember the time when we were kids, we were just not allowed to use skincare products and even talk about it. It's like it was kind of a taboo. If you are into skincare, if you talk about moisturizer, if you talk about using products, that means you're not focusing on studies. So I think that should hold good even today. You need to focus on your studies, your, being something in life, because this is, if you don't focus in these few years, you will be lagged behind, which is like just not done. For a skincare, only a good moisturizer and habit of using sunscreen should start from an early age, not bag full of products.
Got it. Thank you so much for that message. I think we'll also talk a little bit more about this. And I did want to ask, like, for someone who has some conditions or hormonal imbalances, PCOS, PCOD have also become quite common. Not only in
Hmm.
teenagers, sometimes it might happen a little bit later on, or people might find out about it later on when they're trying to conceive or so on. So for those women, then they also sometimes struggle with related skin issues or acne. So how does it all fit into the picture? Because it's not just cosmetic, it's also related to the internal things that might be imbalanced.
Like if we say polycystic ovary syndrome, so PCOS is like one hormone test cannot diagnose PCOS. You
Right.
have to have maybe a triad of things, like you have to have facial acne, you have to have hirsutism, because the kind of hair also would matter. Those thick masculine hair will fall in the hormonal phase. So acne, facial hair, weight gain, along with your changes in your periods, all together will make you a case of PCOD.
Hmm.
Not that you have facial hair and you start thinking of getting into hormonal therapy,
Hmm.
or maybe you have one or two acne here and there and you start thinking I might be having this. This is one of the most common cause of these things like hirsutism or acne, but there are other causes as well.
Right.
So in this age group, we definitely think of PCOD. The moment I see the hair texture is changing, it is getting into thicker kind of hair. Or if the somebody comes with a history of sudden weight gain, definitely I would be asking them to go through certain investigations like their prolactin levels or their ultrasound on a particular day, and combining all these together will make a diagnosis of PCOD. And if we make a diagnosis of PCOD, it is always called a lifestyle disease. So if you start following good lifestyle, like maybe work out for 40 minutes in a day, good hydration, drinking a lot of water, avoiding junk food, avoiding high calorie, high sugar diet, makes maybe more than 60% of the treatment part. So unless you're following a good lifestyle, you cannot treat PCOD.
Hmm.
So once we make a diagnosis of PCOD, then the treatment of acne, the treatment of facial hair will start and will go accordingly. So your lifestyle plays a major role when it comes to either acne or either good skincare, anything.
Got it. But is there a way that someone who might have one or two of the signs, they might not have PCOD, but there is also a diagnosis sometimes made of lean PCOS? So could you talk about that? Or if they have
Yes.
one or two symptoms, how can they prevent it from getting worse?
See, lean PCOD definitely is one of the case, or as a medical professional, we call it subclinical PCOD. That there are certain signs they're happening. The patient is getting a lot of acne, not responding to the conventional medication.
Hmm.
Patient is getting facial hair which are changing in texture. So all these things, sometimes even when the hormonal profile comes out to be normal, we end up giving them maybe low dose hormone to settle their acne and their hair texture. So all that will definitely come into picture. But even in that case, changing your lifestyle to a better and healthy version of lifestyle has no other way to go about treating PCOS. Either it is a conventional PCOD or a lean PCOD or a full-fledged diagnosed case of PCOD or a subclinical case of PCOD. So lifestyle will always play a major role along with your lasers, along with your pills, along with your creams and your other treatment, whatever is required for PCOD. So first and foremost, be it a disease you're facing or you're generally looking for a good skin, the first step is always to follow a good lifestyle.
Makes sense. Thank you so much for sharing that. Good lifestyle is definitely key to good health. And I think it is something that, it's harder to follow. It often feels easier that you can just apply some cream or take some pill and it will fix all the issues. But you're right that the underlying issues will not go away unless the lifestyle changes are made. So when it comes to lifestyle, what are some practices that you like to inculcate in your daily routine?
If you ask me what is my lifestyle, I definitely follow 45 minutes of workout. So when you get up in the if I can follow a workout routine with two kids, one of them is a teenager. So I think anybody can follow 45 minutes of skincare routine. The only thing is it's there in our head ki exercise karni hai. Okay? It's there in our head ki healthy diet leni hai. The only thing is the moment you change the perspective and make it a lifestyle routine, it is easy to follow. Like we never crib कि मेरे को रोज brush करना है, नहीं तो मेरे दांत खराब हो जाएंगे. Have you ever heard anybody cribbing on this? No. ठीक है, because that's part of our system. हम जब से पैदा हुए हैं, जब से बड़े हुए हैं, our parents have taught us to do that. So I think as a parent, that's our moral duty to inculcate the good habits from a very early age. Like if you talk about skincare, as a dermatologist, I keep telling them कि आपने नहाना है, नहाने के बाद में गीली बॉडी के ऊपर कोकोनट ऑयल लगाना है, वापस थोड़ा पानी डालो एंड पैट ड्राई करो एंड अप्लाई अ मॉइस्चराइजर. So this is what is a skincare routine should follow all through your life. रात को जब आप चेंज करते हो, when you're changing to your night dress, apply a layer of moisturizer. ठीक है? So if we start it at an early age, this becomes part of the system. कि अब बच्चा नहा के आ रहा है, उसने मॉइस्चराइज नहीं किया, तो वो कहता है कि नहीं मैं तो नहाया ही नहीं. ठीक है, द वे वी टीच देम कि सोप लगाना है ना. इफ आवर किड्स आर नॉट अप्लाइंग सोप, हम कहते हैं ये कौन सा नहा के आए हो, गो टेक बाथ अगेन. ठीक है, सो इट शुड बी इनकलकेटेड टू देम टू दैट एक्सटेंट कि ऑयलिंग नहीं की, मॉइस्चराइजर नहीं लगाया, तो दैट मीन्स नहाया ही नहीं है. ठीक है, बिकॉज in a medical term, this is called soak and lock theory. See, that if we soak our skin in water, we need to lock the moisturizer. Otherwise, we're damaging the skin barrier. कि आपने नहाया, और बच्चों के नहाने का टाइम भी बहुत इंपॉर्टेंट है कि हम 5 से 10 मिनट तक फिक्स कर दें. अदरवाइज these teenagers take hours in bathroom. ठीक है, so the more you are soaking your skin is water, you're ripping off the natural oils from your skin. And on top, you don't moisturize after taking bath. So after taking bath for a longer time with lot of soaps and shampoos and I don't know what all kind of products they use, and after that if they don't moisturize, they rather not take bath because नहा के तो ज्यादा डैमेज कर लिया अपने स्किन को. ठीक है, तो नहाना है, नहाने के बाद में मॉइस्चराइज करना है और सोने से पहले मॉइस्चराइज करना है, ये रूटीन होना है. And my daughters, it's not that I'm only preaching. When there's not, the oil is not there in the bathroom, when they call out, "Mama, oil nahi hai, moisturize nahi," I feel so good. Wow, I've done it. Okay, wow, they're asking for oil and moisturizer when they are in bathroom. So this is how it goes. So you need to make it a part of your system to follow it for a longer duration of time. नहीं तो फिर हम जब अब हमारे पास बच्चे आते हैं and we tell them like कि आंटी रोज करना पड़ेगा, डॉक्टर रोज करना पड़ेगा, so that becomes a headache. So it just takes maybe 2 to 5 minutes extra to apply a layer of moisturizer because your wet skin is fast absorbing. The moment you apply, it goes in your skin. So it is less than 5 minutes job. The only thing is you need to have it in your system.
Absolutely. So changing to another question, or topic that we discussed earlier, there is a lot of information out there and a lot of product influencers on social media that have impacted the way people understand or maybe misunderstand what skincare or skin health looks like, and especially teenagers, young adults, college girls, and the even early 20s. This is the demographic I would say that is most impacted by influencers and the knowledge that they share. So what are your tips for knowing who to trust online or what information is accurate, or maybe like who do you trust when you need to look up information online?
See, as I told you, whenever we are trying some actives, I don't think so it's a good idea that follow an influencer and buy the product.
Yes.
Because this is what is happening. Because we always forget that skin is a system. We call it the largest organ of the body and we don't respect it that much. So have you ever heard anybody saying ki I had stomach ache, I had some issues with my gut and I just use a tablet without asking a doctor just because I thought it was available online and it is easily available. The packing was good, so I started munching the tablet? No. But when it comes to skincare, why do we do that? Every other person is our skin doctor. We go to the pharmacist and say कि थोड़ी allergy हो गई, कोई गोली दे दे, कोई cream दे दे, and that's it. We start using the creams prescribed to our maybe grandparents and suddenly our kid has an allergy, like oh ye padi hui hai, you start applying that. Okay, so this mindset needs to be changed. You need to know that it is your system and you cannot just use anything and everything which looks nicer to look at and you start applying. If you have no skin issues and you really want to try products, then this is how, maybe as I told you, a good moisturizer or sunscreen depending upon your skin type, you can start buying that. When it comes to actives, like buying niacinamide, buying hyaluronic acid, buying azelaic acid, buying benzoyl peroxide, all these products. So I feel when you are shifting over to some actives, you should always take a professional advice rather than spending so much on products and then something is not suiting you, landing in trouble with your skin, or else just spending on something which is not working on you. Right? So if you want to shift over to a good skincare routine, it's always better to ask a professional कि मैं ये use कर रही हूँ, ये ठीक है? It doesn't take long. ठीक है? And it's a good idea to shift over. Like now it's a time that people like to do layering of the products. ठीक है? कि सीरम भी लगाना है, मैंने मॉइस्चराइजर भी लगाना है. So there are few things which are not to be used together. Okay?
Yes,
There are
which
few
will
things.
interact.
They will interact. There are few things which are good to be used together, right? So if you are somebody who doesn't know much but want to try things, then one step at a time. Maybe you can buy a hyaluronic acid and then use that one product for some time rather than buying 10 products. And if you have already purchased maybe 3-4 products and you are too keen to try out, maybe you can change days at least. One day you can use hyaluronic acid, another niacinamide, a third day something else if you want to try. And it's always a good idea to do a patch test before you buy anything or try anything straight away. You can apply that just behind your ear, leave it on for maybe 48 hours or something and see whether it is reacting. If it is not reacting, the chances of reaction on your face are very, very less, right? So avoid using multiple products at a time. And if you have to do layering, so that should be like जो सबसे thin products है, that has to go first, like vitamin C serum or any serum. Serum will always have a thinner consistency. So apply the serum. Second layer will be moisturizer. Third will be your sunscreen. And if you have to do little makeup, then you can do it on top of it. So this is how you're supposed to layer your products.
Amazing. Thank you for explaining that, because I think this is definitely, as you said, trending, where people want to experiment and try new products. And a lot of that is facilitated by social media, where this kind of knowledge that you're sharing is not shared properly. So I think this is very important for everyone to know, and always consult a professional if they're trying out, products with actives or have actual skin concerns. And this brings me to this question, which I think we'll, before we go into our rapid fire round. So for a lot of young women, there is a lot of, insecurities and other things that fuel their obsession with skincare. And as we talked about it earlier, this is like the wrong approach to thinking about it. So how can anyone, whether it's a teenager or even an older woman, how can we build a healthier relationship, do you think, with our self-image and our skin, and feel confident in ourselves?
See, it's like nobody in this world, I think, will be the person who would just go out without looking into the mirror. So before we step out, we look into the mirror and tell ourselves, I'm looking good and I'm ready to face people. So if you do that, that means you want to have a good and healthy skin. And you are the one who has to be into a skincare routine, anti-aging routine. And if that mindset is there, and if somebody is there, I'm so careful, I don't mind, whatever is the word, okay? It is difficult to get those people in line of skincare routine. So first and foremost, that mindset, maybe more than 90% people will fall into the phase that, yes, I want to look good before I face people. ठीक है? So if that mindset is there, तो फिर बिल्कुल easy है उनको motivate करना कि आपने क्या लगाना है, ठीक है, और कैसे लगाना है, ठीक है? So as I said, the best anti-aging cream will be a sunscreen. कुछ भी नहीं यूज कर रहे हो, आज आपने सनस्क्रीन यूज करना शुरू कर दिया, मे बी 5 years डाउन द लेन यू विल बी थैंकिंग योर स्टार्स कि आपके कंटेम्पररीज से आपकी स्किन बेटर हो जाएगी. ठीक है? सो दिस इज हाउ वी नीड टू बिल्ड अप द स्किन केयर रूटीन कि मॉइस्चराइजर, सोने से पहले मुंह धोना है, बी व्हाटएवर, कितनी मर्जी पार्टी करके आए हो, कितना मर्जी थक गए हो, आपने वॉश करके सोना है फेस, ठीक है, मॉइस्चराइज करके सोना है. इतना भी कर लोगे तो मे बी 10 years down the lane you will be thanking your stars कि I did a good thing to my skin. So that's the only thing. You need to have a good mindset कि भी मैंने अच्छा दिखना है. फिर स्किन केयर रूटीन करने में कोई प्रॉब्लम नहीं है. यू कैन टेक आउट 2 minutes from your routine, be it a teenager or be it somebody who is into their 30s or 40s and getting into skincare routine.
All right. That was wonderful. And I'm sure people will learn so much listening to you. So now we'll go into some fun and light questions, which will hopefully also be good takeaways for our audience. So the first one is, according to you, what's the most overhyped skincare trend right now?
Layering of products.
Okay. Second, one product you'll always keep in your bag.
Sunscreen.
Biggest skincare myth you'd like to bust.
जितने ज्यादा प्रोडक्ट लगाओगे उतने जल्दी आपकी स्किन ठीक हो जाएगी.
All right. A skin tip passed down in your family that actually works.
I told you, नहाने के बाद में गिल्ली बॉडी के ऊपर तेल लगाना है, फिर थोड़ा सा पानी डालना है, पैड ड्राई करना है और मॉइस्चराइज करना है. सो दिस इज व्हाट आवर ग्रैंड पेरेंट्स यूज्ड टू गिव अस बाथ. सो आई हैव सीन देम डूइंग दैट टू माय किड्स. So this is how it actually builds up.
And if you could give everyone one reminder about their skin today, what would that be?
Do not negotiate on sunscreen. You have to have one good sunscreen in your skincare routine.
Awesome. Thank you so much, Dr. Ruchi, for answering all of these questions so beautifully. And it was lovely having you with us. And as you know, with Heal Cycle, our mission with the app and all the work that we're doing is around women's menstrual and hormonal health as well as mental health. And skin is definitely a concern that, plays into all of that. And it's not one part doesn't work in isolation, so it's all part of the system together. So thank you so much for shedding light on that and how we can holistically have a simple skincare routine and also manage like our lifestyle to make sure that we are glowing from within and from outside.
Thank you so much for having me here, and I congratulate on the kind of work you are doing with Heal Cycle. I really appreciate the way you are doing, and I'm grateful that I could be part of the system.
Okay, thank you.